We begin with the province's reopening plan, with changes set to take effect in less than 2 weeks.
The Ford government laid out a three-phase plan, saying there are signs the worst of the Omicron wave is behind us, and restrictions can soon be gradually eased without overwhelming the healthcare system.
Matt Ingram is following the story and joined us live. Good evening, Matt.
Good evening, Taz. Doug Ford says the restrictions his government put in place on January 5th to curb the transmission of the Omicron variant are working. And so it'll soon be time to reopen with an approach that balances the need for businesses to get back to work with the continued risk of the virus.
The Ford government says it's almost time to reopen, announcing a three-phase plan beginning at the end of the month.
We can be confident that the worst is behind us.
It says the positivity rate of COVID tests is declining, new admissions to hospital are stabilizing, and more healthcare workers are now returning to work rather than calling in sick.
We may be reaching the peak of the Omicron wave in Ontario.
The government says Ontario isn't out of the woods yet, so a gradual approach is necessary, but thinks the healthcare system can handle what's to come.
February will be difficult as well. We absolutely anticipate the need to have continued ICU capacity for patients.
Beginning January 31st, Phase 1 will allow gyms, cinemas, and indoor dining rooms, which were all closed when heavier restrictions were implemented January 5th, to reopen at 50% capacity. Retailers, shopping malls, casinos, and indoor attractions can also reopen at half capacity, and social gathering limits will increase to 10 people indoors and 25 out.
We think it's proportionate to the risk at present.
I encourage you to go in and support your local business. Go out to the restaurant.
On February 21st, Phase 2 will see gathering limits increase to 25 indoors and 100 outdoors, and the end of most capacity limits. Sporting and performance venues will be allowed 50% capacity, up from a maximum of 500 people under Phase 1. And on March 14th, the third phase will bring the end of indoor capacity limits in public settings and up the limit for indoor social gatherings to 50. But the government offered no end date for showing proof of vaccination or masking.
All of the measures that we've put in place will remain.
Nor did it say when non-urgent surgeries can resume.
As soon as we can see that the numbers are going down, both in terms of admissions to hospital and in terms of intensive care admissions, then we'll be able to get back on track.
At the very least, folks need to understand what the plan is.
Opposition leader Andrea Horwath wants the government to lay out a plan for dealing with the backlog of surgeries and says it's being overly optimistic about the healthcare system's ability to handle Omicron through this reopening.
I don't know where this rosy picture is coming from, but it ain't rosy on the front lines of our healthcare system, and it's not going to be for a very long time.
Liberal leader Stephen Del Duca thinks the reopening plan would be better if the vaccine certificate system was updated to require a booster shot.
That is our best way to make sure that as a province we don't slip backwards.
Each of the three phases has 21 days in between, but the dates could change if things get worse. The government says that the timeline is contingent on the absence of any concerning trends like a sudden rise in the positivity rate.